So CD30 CAR-T cells have shown really promising results for patients with relapsed refractory Hodgkin lymphoma, but many patients still relapse. So we were looking in ways to further improve the efficacy of CD30 CAR-T cells. One possible way of improving the efficacy may be enhancing trafficking to the tumor site, and that could potentially give CD30 CAR-T cells increased opportunities to eliminate tumor cells before some of the more inhibitory mechanisms become predominant. And as we know, the Reed-Sternberg cells, which are the malignant cells of Hodgkin lymphoma, produce chemokines such as TARC. And these chemokines attract suppressive cells, type 2 helper T cells, and regulatory T cells. And those cells express the TARC-specific chemokine receptor, CCR4. So our thought is that this clinical trial looks at testing CD30 CAR-T cells, which for forced expression of CCR4, with the hope that these CD30 CAR-T cells can have improved migration to the tumor site. So this is a phase 1 clinical trial for patients with relapsed refractory classical Hodgkin lymphoma, adult patients. And we also included patients of CD30 positive cutaneous T-cell lymphoma because of the thought that the CCR4 will improve trafficking to the skin as well. And these patients were treated with CD30 CAR-T cells, which co-expressed CCR4. And we presented data on 13 patients, 11 patients of Hodgkin lymphoma and 2 patients of cutaneous T-cell lymphoma. And these are very heavily pretreated patients, had a median of 5 prior lines of therapy. We didn't see significant toxicity. We didn't see any dose-limiting toxicities. And only 3 patients had cytokine release syndrome. 2 of them was grade 2 and 1 was grade 1. And this was all, the grade 2 cytokine release syndrome was manageable with tocilizumab. And we also showed really high response rates. So the patients with Hodgkin lymphoma, all the patients with Hodgkin lymphoma responded. 8 had complete responses and 3 had partial responses. And we had, out of the patients with cutaneous T-cell lymphoma, we only treated 2 patients today, and 1 patient had stable disease and 1 patient had progressive disease. And we've also seen the follow-up is still short, but we've also seen some durable responses, including 1 patient who's still in remission at 3 years post-treatment. Basically, we show that CD30 CAR-T cells co-expressing CCR4 are safe, and they have promising efficacy in patients with relapsed refractory classical Hodgkin lymphoma. And we even saw responses at the lowest dose level, and this suggests that early tumor homing driven by CCR4 expression may allow CAR-T cells to exploit their anti-tumor potential. And this is also proof of concept for future modification of CAR-T cells to improve their localization to disease sites. We have looked at our prior clinical trial of CD30-directed CAR-T cells to help determine what factors might be associated with more prolonged progression-free survival. And we looked at several different factors, including bridging therapy and response to bridging therapy and CAR-T cell expansion and persistence. And actually, in our trial, we did not find that any of these factors was associated with progression-free survival. The one factor that we found that did seem to be associated with progression-free survival was baseline metabolic tumor volume. So patients who had higher metabolic tumor volume at the time prior to lymphodepletion had a shorter progression-free survival compared to patients who had a lower metabolic tumor volume.